Today I want to talk about an essential aspect of healthcare that affects millions of women across our nation: the coverage and accessibility of breast cancer screening and follow-up imaging. While the Affordable Care Act has made great strides in providing coverage for mammogram screenings without cost sharing, a pressing issue remains for individuals at higher risk for breast cancer or those requiring follow-up imaging due to abnormal results. Many of these individuals are faced with staggering out-of-pocket costs, often ranging from hundreds to thousands of dollars. We have a staggering statistic of 1 in 5 patients will skip recommended follow-up imaging if it means having to pay a deductible. This is a troubling reality, particularly for those who have previously been diagnosed with breast cancer, as they often encounter even higher costs due to the need for diagnostic rather than standard screenings. Mammography is just the beginning of the early detection process, and I would encourage everyone to get that screening. It is important to understand that while a mammogram can indicate potential issues, it cannot diagnose cancer on its own. In fact, about 12% of individuals will require additional follow-up imaging after an abnormal mammogram. This follow-up is vital, as it can confirm the need for a biopsy or rule out the presence of cancer altogether. Unfortunately, the financial burden associated with these necessary diagnostic and supplemental imaging procedures can deter patients from seeking the care they urgently need. I just want to introduce one of my constituents, Tracy Smith from Tracy's Bio. Tracy lives in Lansdowne, and she is a thriver. And she has been doing the work to make sure that women and folks that get diagnosed with this horrible disease can get what they need. So thank you, Tracy, for being here today. In Pennsylvania alone, over 13,370 individuals will be diagnosed with breast cancer this year, and tragically, more than 1,820 will succumb to the disease. Despite advancements in breast cancer screening and diagnostics over the past 3 decades, these disparities remain. On average, a diagnostic mammogram costs around $234, while a breast MRI can reach as high as $1,021. These figures highlight a critical point. When faced with high out-of-pocket costs, individuals are less likely to pursue the recommended follow-up imaging. This also speaks to a statistic that 40% of Black women are impacted by this, and we know that the costs are a real issue. This delay can have dire consequences, allowing cancer to spread and making treatment more complex, costly, and ultimately less effective. That's why we need to take action. I urge legislators to support House Bill 1944, which aims to eliminate these burdensome cost-sharing requirements for medically necessary diagnostic and supplemental breast imaging. By doing so, we can increase access to vital care, ensuring that every woman receives the timely follow-up she deserves without the fear of financial hardship. By advocating for fair and equal coverage, we can help save lives and reduce disparities in breast cancer care. Thank you.